Peripheral neuropathy does not have to be permanent. In this video, I'll give you the most current and most effective pain relief treatment strategies for peripheral neuropathy. If you are looking for an alternative and safe treatment for peripheral neuropathy without using conventional medicines and surgeries, then this video is for you. In order for peripheral neuropathy treatments to be effective, they need to specifically address two key things. First, it needs to reduce inflammation. Secondly, it needs to help increase blood flow and circulation. This is the cornerstone to any successful peripheral neuropathy treatment program. In this video, I'll show you 5 specific treatment methods proven to reduce inflammation and improve circulation in patients with peripheral neuropathy. What does this mean for you? You will gain knowledge of these 5 methods, enabling you to seek out a treatment center that offers them and finally obtain the relief that you've been searching for. You will finally have a guide and know exactly which treatment methods to seek, no matter what type of peripheral neuropathy you have. When you stick through these treatment methods, they will not only slow down the disease, but can halt the disease process altogether, while having the potential to even reverse the nerve damage. In addition to all this, be sure to watch till the end, because I will give you a bonus tip. 3 things that everyone with peripheral neuropathy must do daily to ensure you are giving your body the best chance to heal. Hi, I'm Dr. Ole Olson, America's neuropathy coach. For almost 20 years, I've been helping patients with dealing with peripheral neuropathy. I've assisted thousands of patients and taught hundreds of doctors nationwide on how to manage this condition gently and effectively without the use of drugs or surgery. I founded Asuta Health, which has expanded to 5 clinics across the Midwest, specifically focused on serving and treating individuals with peripheral neuropathy. I chose the name Asuta for its meaning, to be healed, reflecting our deep commitment to healing those afflicted by this debilitating condition. Recognizing the difficulties in managing constant pain, the scarcity of widespread knowledge among healthcare providers, and the ongoing quest for effective treatments, this channel aims to bridge the gap. Our mission is clear: to offer hope and relief to everyone suffering from peripheral neuropathy. Now go ahead and smash that subscribe button if you're looking for breakthrough methods that can significantly reduce your neuropathy pain and improve your daily life. In addition to that, I wrote a book called Reversing Neuropathy: Key Components for Getting Your Life Back. You can get a free copy at the link in the pinned comment below. In a moment, I'm going to outline the 5 treatment methods that are proven to reduce inflammation or improve circulation, or maybe even both. But first, let's review the main causes of peripheral neuropathy. Now, typically we see 3 main causes: diabetic neuropathy, chemo-induced neuropathy, and the third category called idiopathic neuropathy, which there are 100 different causes within those. Now, with all the different hundreds of different causes of peripheral neuropathy, I would say the one biggest or most common cause that we see is reduced blood flow and circulation. Now, if you think about my hand as a nerve cell, these are all the different components, all the different vessels coming in to nourish that nerve. Blood vessels bring in oxygen, they bring in nutrients, all those things that nerve needs to heal and to function properly. So when we have some of these issues, whether it's a blood sugar issue, whether it's a chemo radiation issue, or one of those other hundreds of different causes, as the blood flow starts to begin to get restricted, you can see that we start to lose that blood flow coming into the nerve. And ultimately that nerve will start to fire off different sensations. You could feel burning or numbness, tingling, other types of pains, but eventually it's going to not feel anything at all, right? The more dead that nerve gets, the less feeling we have. And so this is why in over 90% of the cases that we see, when we start to introduce more blood flow, more circulation in the area, give those nerves the nutrients and oxygen they need to function and to heal, we start to see magical things happening. This is why we work with these 5 treatment methods, because they can cover and treat over 90% of all peripheral neuropathy cases. So let's dive in. The first one is low-level light therapy. Low-level light therapy is a type of therapy that stimulates cellular energy production, which can help reduce inflammation and improve nerve function. It also helps alleviate some of those aches and pains you may feel in your hands or your feet. The next one is vibration therapy. Vibration therapy helps to wake up the nerves and helps to reconnect those areas of the body back to the brain while increasing blood flow and circulation. Stimulating these parts of the brain help to wake up those areas of the nerves so they can communicate more effectively and efficiently. The third one is regenerative therapy. Regenerative therapy can include things like stem cells, PRP injections, and different therapies that promote regenerative and healing within. Now, regenerative therapy helps promote nerve regeneration and repair. And with these therapies, we can get very specific with the targeting of the treatment, so we know exactly where we're going to activate those stem cells. The fourth one is soft tissue therapy. Soft tissue therapy can consist of many different types of therapies, really helping to increase blood flow and circulation, while also helping to improve range of motion and reduce aches and pains. The last one is spinal decompression. This is a common one that is often missed because people are looking just at the problem area. We tend to look upstream as well to make sure we're not missing out on what the up the stream could be causing. Spinal decompression looks there to see if we're dealing with any sort of nerve compression that could be causing neuropathy at the nerve root level. Many times these nerves are affected there, which is where the nerve exits the spine. So it could be in the neck, going down into the arms and hands, or in that lower back, going down into your legs and feet. Decompression therapy removes the stress on the nerves, allowing for better communication through the nerve and helping to reduce the symptoms of pain, numbness, and even tingling. Now you know 5 treatment methods for treating peripheral neuropathy without drugs. Before I give you the bonus tip though, I'd like to introduce you to Pam. Pam was a patient at Asuta Health and came into us with pain in both feet that affected her ability to work. This is her story.
I had neuropathy in my feet, both feet, and I stand all day at work and it was bothering me so much that I couldn't function anymore. So I came for help.
Jeez. So we started just a few months ago, just had the re-exam. Testing was phenomenal.
Yeah.
The great changes. And so what have you been noticing? You've been able to stand better at work now?
Yep. I'm not having the numbness and burning and sensation in my feet as much. Yeah, it's a huge improvement.
And unfortunately, she got stung by a bee and felt that.
I did. Yep.
There's always a bad side to getting to healing your neuropathy, but ultimately you're happy with it, I'm guessing,
Yes.
right?
Yep, very much so.
Yeah.
Wow, wasn't that awesome? We hear these success stories on a regular basis at Asuta Health. Now it's time for the bonus tip. Bonus tip number 1. First thing we've got to do is we have to move more. Now I know for some people this can actually cause pain and increase your symptoms, so I want you to start really slow. This can be as simple as moving your hands around and seated in your chair, moving your foot around, but we've got to get moving. Activity helps to increase blood flow and circulation, so even just a few minutes at a time can be hugely beneficial. So like I mentioned, start small as some people will have a negative reaction to this, and you want to build up slowly over time. So if you start off maybe just 30 seconds or a minute and do that several times a day, and then add in more repetitions, then add in more time to each repetition. The second thing is we've got to be diligent about the things that we're putting into our body. This means what are we eating and what are we drinking? The food and drink that goes into our body is either producing more inflammation or helping to reduce inflammation. And only you can control what goes into your body. Thirdly, we need to implement some of these home therapies that I've developed for people suffering with peripheral neuropathy. If you haven't done those yet, check some of those out, try them out, see how they're working. And then one last tip I want to throw at you, if you've tried these things and you're still struggling, don't hesitate to reach out. Ask for help from a professional because some of these things are going to be so severe that you're not going to be able to handle them on your own. So reach out, connect with someone that can help you, and get on the right track. I hope you found this video helpful and learned how to treat peripheral neuropathy naturally. Now I want to hear from you. Tell me about your journey with peripheral neuropathy. What treatments have you tried? Tell me what treatments worked for you and what treatments did not. Leave a comment below. If you found value in this video, please like and share it so others suffering from peripheral neuropathy can discover these natural treatment methods as well. Be sure to subscribe to my channel to get more breakthrough methods that can drastically improve your quality of life. These methods hopefully will help you reduce the neuropathy pain and just get you feeling better and functioning better all around. The next video you should watch is this one right here. I'm gonna go through my 3-step home care protocol for peripheral neuropathy pain relief. So go ahead and watch this video next.